for Owen, we could put a little bit of filler right on either side. Hi there, Dr. Tansavatdi here. So today I'm going to be talking to you about non-surgical rhinoplasty. Let me tell you a little bit about what a non-surgical rhinoplasty can accomplish. One of the things that a non-surgical rhinoplasty can do is take care of anywhere where the nose looks crooked, we can straighten it. So if the first thing that we can do is address a crooked nose. So a crooked nose, particularly if there's a depression on one side and the other side's flat, we can fill in the depression and make it look straighter. So here for Owen, we could put a little bit of filler right on either side. The tip is still hanging and turning to one side. The other thing that we can do with a non-surgical rhinoplasty is putting filler in the tip of the nose. So the tip of the nose, if it's crooked, we could do a little bit of subtle enhancement and improve that, but the best thing we can do with fillers for non-surgical rhinoplasty is putting filler in the tip and creating an illusion of a rotation of the tip and projection of the nasal tip. So the tip looks a little bit longer and also a little bit rotated. So I'll give you an example. I have a patient here that I have done. This is a patient of mine. And you can see she has both a hook because the bridge is high here and it looks like she has a bump, and the tip is rotated down like she has a hook. So one of the things we do is put a little filler right there, the tip, lift it up, and also along the bridge to make it smooth. So now it gives this illusion that she has a straight bridge and a lifted tip, so it looks more feminine. All right? So the two indications I already said, to recap, one is for the bridge, also for crooked nose. Two, for the tip, to raise the tip. And then I'm going to be talking about a third one. So we talk crooked, the nasal tip, and then building a bridge and hiding a bump. So I have a little model here. All right, so Sarah here, I'm gonna have you turn for the camera so you can see off to the side. All right, so off to the side, if you take a look at, let's see if we can do it here too as well. Okay, if we take a look at the bridge of her nose, not to mention, and this is not to say that you're not beautiful, okay, Sarah? But her bridge is a little low, okay? She has a great super tip break and then a good rotation to her tip, so she wouldn't need any there, but she could benefit from a little bit of filler to the bridge because it is low in relationship to the tip, so it does quite a bit of a swoop there. Can you see that on the video? All right, so thank you, Sarah. That's a low, we call it a low nasal bridge or low radix. It's usually an ethnic feature. Asians and other ethnic types like African American can have a flat nasal bridge, and that can be addressed with non-surgical rhinoplasty with fillers. Then the last candidate I talked about, the fourth, was a bump, and that can be addressed with non-surgical rhinoplasty using fillers to hide the bump above and below the area of the bump. So there you have it. Those are the four indications. I said a crooked nose, a tip that is droopy, a low nasal bridge, and a hump. All right, thank you for tuning in.